I think a lot of effort has gone in by the scientists and the partnerships that we have forged while developing this first plasmid DNA vaccine in the world. I think it's a very important moment for the company and also for our country, because this paves the way forward for the development of this technology, which is the recombinant DNA technology, to be used for not only creating more vaccines, but also creating more therapeutics in the fields of oncology and others. So I believe that this is the first stepping stone to prove and build onto this technology of DNA, using plasmid DNA to produce for vaccines. We are also very happy that, in a record time, we could finish a recruitment of 28,000 plus volunteers. And I really thank all the volunteers who, went through the trial with us and gave the assurance and trust in the vaccine. And that without that, this would have not been possible. Special thanks to even all the recruiters and the doctors and hospitals who helped us at more than 50 centers in India to make sure that we could achieve this, including for the children between the ages of 12 to 18. So a lot of effort has gone in, both in the back end and also in the front end, building the new plant, building for the new devices. So a tremendous amount of effort and tremendous amount of value being built by the scientists at the company, and also partnership with BIRAC and DBT and others. So very happy to see that finally we see an outcome and an EUA for this platform of vaccine.
So right, let's talk about the next step. Our viewers don't know that this is a new and a different technology, one of its kind in the world. Can you just tell us what does this mean? We've seen that it's a needleless virus, that vaccine that we are talking about to fight against this virus. Can you just in simple terms tell us what does this mean for our viewer?
Yeah, so I think there are a couple of things new with the platform. One is it doesn't have any immunogenic properties in terms of having any vector-based immunity or anything related to that. We always believed that for a coronavirus kind of virus, we would need multiple dosing in the future. And also potentially with the new variants, more dosing will be required. So we believe that this platform is very safe to be taken judiciously more often. So that was one of the critical reasons to do so. The other is it's an extremely thermostable platform, which helps us that it's stable at not only at 2 to 8, but even at 25 degrees, it's stable for at least 3 months. We have shown that even after freeze-thaw cycles, even if the vaccine is by mistake frozen, it can still be used in its normal state again. So there are a lot of advantages to do with that. And the most critical advantage is this time, this is the world's first way of mass using an applicator to deliver this device, which is needle-free. So there, 25% of the population has some phobia related to blood and needle pricking. And I believe this will completely eliminate that fear that a lot of people will have related to vaccine hesitancy, because this is needle-free and it's just a high-pressure jet injector that goes into the upper part of the skin, into the dermis, with a very small dose of only 100 microliters. So I think all in all, I believe that this would see a tremendous amount of, when the user experience, which would be very good. When we completed our trial, we didn't see dropouts on our trial. And that, I think, one attributable reason to this is the ease of administration of this dose, and also minimal or no severe side effects, which also helped us to recruit patients better.
Exactly. So now the tough part is done, that you have done your research, you've got the approval. Let's talk about execution. How soon will you be able to get this in the market? What is the current inventory that you have? There were some changes. So does that mean that you will take some time before it comes in? How are you preparing for the 3-shot? It's 2-shot, people are finding it difficult. How are you prepared for the logistics or execution?
So yes, I think, as we're juggling many things, we also at the same time have been preparing for the execution of the vaccine. So we have commissioned a brand new facility for producing this at larger scale. We got delayed in doing so for at least by 45 days because of the April, May, June severe onslaught of COVID and lockdowns, and also no international travel. So we did see some challenges, but I am still very happy to say that in spite of that, this new plant has come up in a record period of less than a year. So which is very important for us. The second is we also created a facility for drug product filling, which is critical, and that's also been created. Also, we had an additional problem to solve, which is the device and the applicator. And that also we have now finally solved for and put investments behind that as well. So I think from that point of view, we're well prepared. We have also prepared the logistics in terms of how we will distribute this once we get the go ahead. Also look at how do we link it back to the COVID app, and that all integration is also on track. Creating a better user experience for the people who take the vaccine in terms of its effects, its the reminders in terms of what to be careful about. All of that has been created in terms of a digital framework. So I think a lot of effort has been put in and risk taken to do all of this. Now we are now starting the manufacturing at large scale. So now the next challenge for us to make sure that we can scale this up and produce it at large quantities, which we hope we can do so in the next 45 days and gear up a production to about 1 crore doses a month, which is what we are building towards. With respect to the difficulty between 2 doses and 3 doses, the good part of this is that in spite of 3 doses, the full dosing gets over in less than 60 days. So it's only 58 days. So I think comparably vaccines have a longer duration in terms of doing the break between the 2 doses. So I think that should aid well for the vaccine. And as I said, the whole delivery platform is so good and easy. I believe the experience will help us also gain traction in terms of hesitancy towards vaccination.
So one of the key things about your vaccine is that between 12 to 18 also you have done trials, and that is something which of course gives it a differentiating factor. So out of the 10-12 crore total number that you have in mind for the entire year, how much would be reserved for that age group, because that is the age group where people are vulnerable as to how and when a vaccine would come?
So that is definitely an important area. Today we have this ZyCoV-D becomes the current vaccine that is approved for children between the ages of 12 to 18. I also believe that the large part of the vaccine would be made available for this age group because that is the age group that requires some kind of vaccination. And then, so that discussions we will have now with the regulators and the center to see how do we prioritize the vaccination in terms of age group and in terms of comorbidity and other things. And once we are more clearer on that, we can give further guidance on that. But I believe, this would be definitely in the first go, a larger part of the adults in population should be given this vaccine.
So when we just talk about the vaccine approval, I think there is some more data required after the second vaccine has been given. Does that mean the company will have to do more trials? Is this still an ongoing process and more developments will happen on this?
So, the follow-up has to continue. So phase 3, we have recruited 28,000 people. For children, we have finished 1,400. We have to follow them through for the next 6 months. So that will continue. With respect to the other thing that is related to the 2-dose regimen, which we have completed our immunogenicity work. And now we are in discussions with the regulator and SEC to see how do we best forward. Also try to convert from a 3-visit to a 2-visit regimen. And once we have more information in the next couple of weeks, we'll talk about it also.
Right. So just wanted to understand, I believe you don't have the pricing of the product at this point of time, but have you spoken to the center? Will this be available only with the center at this point of time, or will it also be available through the private channel with certain reservations?
So we have not had any dialogue yet on the pricing or the modality in terms of how much will be procured by the center versus the private market. We have obviously the current precedence that is there where 75% of it gets delivered to the center, which distributes it, and then 25% for the private market. But that discussion we have not had yet. So it will be too early to comment on that. Our goal now is to make sure that we make the vaccine available for the vulnerable population, especially the 12 to 18. And we'll make all our efforts to see that we are able to sort of discuss that and then bring that to market.
Right. Just a last word before we end. Firstly, how much inventory do you have? How soon we expect the first shot coming in? And secondly, I just wanted to understand, are you going to, say if the need is higher, the acceptance of the vaccine is, on the higher side versus what you anticipate, would you be investing more in generating capacity at this point of time?
So these are all important questions. How fast we will get the product to market. We have to obviously go through the sterility program of 14 days internally and then 14 days with the CASOLI to make sure that the vaccine can be made certified and made available. So that's the first step we need to do. As I said, we just started scaling up to large manufacturing from as we speak as of yesterday. So we believe that we will come to steady state production from October, where we are able to produce about 90 lakh to 1 crore plus doses in a month. And if everything goes well, we will try and make certain number of doses available by mid to end September.
Right. So just one more thing, your vaccine has come in a little later, it is a 5th or the 6th approval, but between that we've had a Delta variant as well. So is there any data that you would like to tell our viewers about the Delta variant, how effective it is against that? Has there any study been done so far on those lines, or is it ongoing that you would like to tell our viewers?
I think one thing that is important for all of us to understand is that for the efficacy trial that we have done for the ZyCoV-D vaccine, all our events, which is the number of positive cases that we got to see in the efficacy trial, have happened in the months of April, May, and June. So, and that is a period of time where only predominantly the Delta variant has existed in the country. We did a sequencing of many of the positive cases that we found, and all of them were Delta variant. So when we talked about 66.6% efficacy, this efficacy is the last trial is a true reflection of the current situation, which is related to the Delta variant. So it is safely possible to say that at least our efficacy that we have shown is with regards to the Delta variant, because that is the only variant of concern that was mainly present in this period of the last quarter.